This is the instructions for the modified low-calorie diet. You should be aware that patients will transition from the full low-calorie diet to the modified low-calorie diet, and in that circumstance you should give them module number 12, which explains the transition. This is going to go over how to enroll a new patient in the program in the modified version. Ms. Matthews, I think you're making a good decision doing the modified program. It sounds like your lifestyle is going to make it very difficult to follow the full program. The modified program, what it consists of is you're going to have a shake for breakfast, shake for lunch, a bar or shake for a snack, and then a meal that is around 550 calories. Now, that meal could be for lunch or it could be for dinner. Sometimes people will switch it. If you were having a difficult time with hunger, we could possibly prescribe an appetite suppressant at a later date, but today your blood pressure is a little bit elevated, and I'd like to see what happens with weight loss and see if next visit we need to adjust your medication or the blood pressure will take care of itself. But that's sometimes an option to combine along with the modified program. Now, as far as the 550 calorie meals go, at our website, cmwl.com or centerformedicalweightloss.com, it's a free registration. If you sign up, you'll be able to get access to all of our modified recipes. And it's a fun area of the website where people actually rank their favorites. But all of the meals are 550 calories. You could search for specific dishes if you want. And we recommend that you do your best to keep it to 550 calories with some form of protein in every meal. So if there's something you'd like to eat, you could certainly have that, but you need to weigh it and measure it and portion control it to around 550 calories. And I recommend you journal that as well. If you're looking for recipes, the website is a great place to go. And what we also have available now with the Center for Medical Weight Loss is a program called Doctor's Orders Meal Delivery. So we could deliver you 550 calorie meals for dinner. And so you would have the 3 meal replacements during the day, and then you'll have a dinner meal delivered that kind of portion controls everything for you. To do that, you would go to the website on this sheet, and you would put in the code. And if you put in that code, you actually get a 10% discount because I referred you to join. And it should make it easier. So some of our patients like to start with the meal delivery and then transition to making dinner themselves and then, of course, to all food. And some even enjoy the meal delivery program over time. They would get dinners delivered and sometimes just work on breakfast and lunch. But it's completely up to you.
So I've never counted calories before. How am I supposed to go about doing that?
It's really important. If you can go to the kitchen store, a place that sells utensils, buy a food scale, and you should weigh and measure all portions. 550 calories. We'd love for 300 calories or more to come from protein. That's meat, fish, there's soy, there's dairy, but you want to make sure that there's some form of protein in the meal, and the rest you just want to portion control. To make it easy, we've posted recipes on our website that are that 550 calories. You could look up the calories, you could purchase a book. We have some up front where you could look up foods. And I also recommend you journal what you're doing because that makes it easier to track the calories as well, and it's a good habit to get into. And we have journals that will help you with that as well.
Okay. And then also, are there certain foods that I should stay away from?
So there's no foods that you should stay away from per se as far as the diet goes, but because you have high blood pressure, it's not good to eat so much sodium. Because you're a diabetic, you may do better with less carbohydrates, especially processed carbohydrates. But for the diet to be effective, we just want that meal to be around 550 calories.
So I should stay away from the creamy dressings?
You should stay away from the creamy dressings, just vinegar or your own kind of light dressing. And beverages should count within that 550 calories.
Okay.
Terrific. I'll see you back in 2 weeks.
Great, thank you.